There's just two words. There's visibility and there's education. And if you ask doctors, have you got any trans people on your books? Most of them will say, no, I don't have any trans people on my books. And I'm like, you do have trans people on your books. It's just they haven't been brave enough to tell you yet that they are trans. And then the education, where is the medical education for helping and managing hormones in transgender people? So there is no education at medical school. The only medical schools, and certainly when I was at medical school and I qualified in 1992, there was none. And more recently there may be some education about gender identity, but that's really basic. It's about teaching somebody that actually your gender might be different to the one that's on the birth certificate, and we need to treat these people with respect, and we need to respect their name and their pronoun choices, etc. And I'm like, yeah, hurry up, that should have been done ages ago. Can we get to the bit where we actually help them medically? And that's definitely not in the medical school curricula. And then after medical school, when you've done your medical school training, you should have a completely broad understanding of medicine and all the different conditions and how to help people. So just a broad general understanding, how the body works, how it goes misshapen sometime, and what you do about it. And then after medical school, you do general medical training in hospital. And you do a little bit of everything just to learn how to be a doctor. And then after that, you go to proper training placements. So you might want to be a psychiatrist, you might want to be a paediatrician, you might want to be an orthopaedic surgeon. And in all of that, there's still no training posts for working with transgender people. And so you think, well, maybe it's in endocrinology, because that's what does hormones. But if you look at the endocrinology curriculum, it's not there. It's not on the curriculum. And you're like, okay, well, maybe it's on psychiatry, because they used to think that being trans was a mental health condition. Maybe it's on psychiatry. It's not there. It's not in medical school. It's not in postgraduate training. And you're like, okay, well, maybe there's just some courses that you can do if you're interested. And believe me, I've looked, because when I was interested, I needed a course, and there aren't any. And the very basic courses that are there are still those ones teaching you that someone's gender can be different to the one on their birth certificate. So how do you switch off someone's hormones from their testicles or ovaries and safely give them the other one? Where's the book that tells me how to do that, or the training course, or the qualification? They're not there. So we have no visibility for doctors, because people are scared to come out and be visible. And then we have no education for doctors. And then we have the standards.